Hi, today we're going to be discussing fifth disease as presented by me, Wendy McIntyre, and we're also going to be discussing a case study and all the relevant assessment data, any treatment, complications, and important nursing diagnosis and interventions in relation to the patient in the case study, along with a Kahoot. And so I hope you enjoy it and learn something today. Learning objectives we'll be trying to obtain today are able to recognize the signs and symptoms of fifth disease, understand how fifth disease is acquired and how to prevent the spread of the disease, and recognize interventions that can help increase the comfort of a client with fifth disease and the education needed for those interventions. The client that we'll be presenting today is Sarah Smith, a 6-year-old Caucasian female, is being seen in her pediatrician's office due to the appearance of a rash that started on her cheeks of her face but now has spread to her chest and extremities. Sarah's mother, Mary Smith, states that Sarah had a low-grade fever, a runny nose, and complained of a sore throat the week before. Mrs. Smith states she kept Sarah home from school for 2 days due to her being too sleepy to get through the school day. Mrs. Smith states that Sarah had returned to school yesterday, but she noticed the rash on her cheeks upon Sarah's return from school, and then this morning it had spread to her chest and arms. The nurse asked Sarah if it's okay if she asks her mom to lift up her shirt so that she can get a better look at the rash. Sarah holds the bottom of her shirt down while shaking her head no. The nurse tells Sarah that she understands she's scared and assures her that all she needs to do is look at her chest and stomach and that it won't hurt. Sarah states, okay, but will you be able to make it go away? My friends at school say my red face is gross. The nurse assures Sarah that if the rash is due to what the doctor thinks it is, then yes, it will eventually go away, but may take some time. Sarah looks towards her mother, who gives her a smile and nods her head yes. Sarah slowly loosens her grip on the bottom of her shirt and allows her mother to help her lift it up so that the nurse can assess the skin underneath. Assessment information gathered. We have mental status, alert and oriented to person, place, time, and situation. No known allergies to medication or food. You have a erythema bilaterally on the cheeks, which with fifth disease is also known as slapped cheeks. There is an illustration in the upper right hand corner that will show you what that looks like. Nose is clear, patent bilaterally, no rhinorrhea. Throat, no signs of pharyngitis, no difficulty swallowing. Integumentary, on the chest, there's an erythematous rash on the chest located bilaterally from clavicle to 1 inch below umbilicus, presents in a lace-like pattern that is also shown in the illustrations in the upper right-hand corner. Arms, erythematous rash located on posterior arms bilaterally from axilla to elbow. Musculoskeletal, range of motion completed on all extremities, no signs of weakness or stiffness, and patient denies pain or soreness. Vital signs are temp 98.8, blood pressure 101/68, pulse is 82, and respirations are 22. Vital signs after the appearance of the rash occurring in fifth disease are typically normal due to the initial stage of infection by the virus being completed and the immune response causing the appearance of the rash. Once the rash appears, the patient is no longer contagious. Fifth disease has no formal treatment options as it is a self-limiting disease process, meaning it will go away on its own. Comfort measures are used to help with the effects of and signs and symptoms. Tylenol or ibuprofen can be administered to help with body aches or fever. Benadryl can be given to help alleviate pruritus experienced due to the rash. In rare cases, IV immunoglobulin can be given, but only in life-threatening cases. Drinking plenty of fluids and getting plenty of rest will help the body fight off the virus. Some case study questions are: 1, how can fifth disease be prevented? Fifth disease can be prevented by washing your hands often for at least 20 seconds with soap and water, covering your mouth and nose when you cough or sneeze, avoiding contact with people who are sick, not sharing food, eating utensils, or drinking cups, and if you're sick, stay home. Implementing these actions helps to prevent yourself and others from encountering the virus through touching droplets from coughing or sneezing, or droplet secretions that are on surfaces, or from sharing cups, utensils, or food. Question 2, is there a vaccine for fifth disease? No, there is no vaccine for fifth disease. Fifth disease is a virus that has no vaccine and is difficult to prevent the spread of due to the inability to detect that someone is infected, usually until after the appearance of the rash. And what causes fifth disease is the parvovirus B19. This virus is usually airborne and is usually spread through saliva and respiratory secretions. It can also be contracted through contaminated blood. The parvovirus B19 is contracted through airborne droplets from coughing or sneezing. It can also be contracted through bodily fluids when sharing drinking cups or eating utensils, and less commonly, it's also gotten from contaminated blood. Number 4, what does fifth disease look like? Fifth disease usually presents as a rash that first appears on the cheeks and then spreads to the trunk, arm, and legs. The rash is red and lace-like in appearance. The rash that is a marked sign of fifth disease is erythematous and lace-like in appearance. Question 5, what is the treatment for fifth disease? Comfort measures are usually the only treatment needed for fifth disease. The administration of ibuprofen or Tylenol for fever and Benadryl to help relieve the itching of the rash can be used as comfort measures. Fifth disease is self-limiting, therefore the only thing that can be done is wait for the body to fight the virus off on its own. Question 6, what are the symptoms of fifth disease? Symptoms of fifth disease are low fever, headache, sore throat, muscle aches, chills, or respiratory symptoms. Fatigue can also be experienced. Fifth disease has 3 stages. The first stage, this is when the cold flu-like symptoms manifest. The second stage is when the facial rash appears, and the third stage is when the rash appears on the trunk, legs, and arms and appears lacy. Question 7, how is fifth disease diagnosed? Fifth disease is usually diagnosed by the distinctive rash that appears. A healthcare provider will sometimes perform a blood test, but usually this is not needed unless a complication is expected. Question 8, when can my child return to school? Once your child presents with a rash, they are no longer considered contagious. Therefore, if they are feeling well enough, they may return to school. Once the child develops the rash, they may return to school. If your child experiences a fever with the rash, then they should not go to school until they are afebrile for 24 hours. Question 9, what are the concerns for long-term effects? There are usually no long-term side effects from fifth disease. Once a child has fifth disease, they usually develop an immunity to the disease and will not get it again. Children that are otherwise healthy do not normally experience problems. Question 10, when to seek medical care? Call your doctor if your child experiences a fever greater than 104 degrees Fahrenheit or lasts for more than 3 days. Medical care should be sought for a rash that fails to clear after a few weeks. Any of these occurrences could signify a complication and should be evaluated by a doctor. Sarah and Mrs. Smith are grateful to have all their questions answered and have verbalized correct understanding of the prescribed treatment, available comfort measures, and when to seek medical care if needed in the future. Mrs. Smith requests a note stating Sarah can return to school. Sarah is looking forward to returning to school tomorrow and telling her friends about how to wash their hands so they don't get sick like she did. Client education for nursing diagnosis and intervention. Intervention 1 would be impaired comfort related to rash as evidenced by Sarah's complaints of face and tummy itching. So education for the client would be to take ordered medication on a regular schedule to keep discomfort to a manageable level. Waiting to take medication until symptoms such as itching are severe will increase discomfort and cause medication to not be as effective for symptom control. Intervention 2, use of non-pharmaceutical symptom management such as cool compresses, listening to music, or watching a movie to distract yourself will allow for relief of itching in between taking medication and will increase comfort and ability for self-care of symptoms. Intervention 3, controlling the urge to itch will help reduce the risk of breaking open the skin, which can lead to infection, which can cause complications with recovery. Education for nurses on interventions. Use a comfort scale using numbers 1 through 10, much like you would use with a pain scale, to measure the client's level of comfort. The use of a number scale allows for accurate measurement of subjective patient complaints and increases the effectiveness of interventions given. Reevaluating patient response after intervention is given will help evaluate the effectiveness of the action, which will help decide if the intervention should remain as is or if the plan of care needs to be adjusted. 2. Provide Sarah with Benadryl every 6 hours as needed to help relieve itching when comfort level is greater than 4. Maintaining medication administration on a regular schedule will help better control patient comfort and reduce complaints due to allowing for better control of the symptoms before it becomes severe. 3. Provide non-pharmacological symptom management by use of age-appropriate comfort measures, such as the use of cold packs to affected area or distraction techniques such as board games or movie watching. Educating clients on alternative comfort measures allows the client to feel like they have some control, which can decrease anxiety, help reduce complaints, and can also reduce medication use due to controlling discomfort in between medication administration. How can fifth disease be prevented? Thorough hand washing, not sharing food utensils or drinks, staying away from those that are sick, or all of the above. And the correct answer is all of the above. True or false? There is a vaccine for fifth disease. And the correct answer is false. There is not a vaccine for fifth disease. What causes fifth disease? Streptococcus bacteria, parvovirus B19, drinking from contaminated water sources, or none of these. And the correct answer is parvovirus B19. True or false? Fifth disease usually resolves on its own without medical intervention. And the correct answer is true. What is the treatment for fifth disease? 7-day treatment of penicillin, eating fruits and vegetables, comfort measures such as ibuprofen, acetaminophen, or Benadryl, a course of antiretroviral medication. And the correct answer is comfort measures such as ibuprofen, acetaminophen, or Benadryl. And that is the end of our Kahoot. I hope you enjoyed it. Here are the references that I used in order to help make this PowerPoint presentation. Thank you so much for taking the time to watch my PowerPoint presentation. I hope that it helped you to learn more about Fifth disease, and I hope that you enjoyed it.